So we will be talking about brachial plexus. So first I'll give a small explanation on notepad, followed by seeing the 3D model. So these are basically the spinal cord segments. So this is the spinal cord segment C5, C6, C7, C8 and T1. So we know that a spinal nerve, so the spinal cord has anatomy something like this. So this is the spinal cord. This is the anterior segment, this is the anterior part, and this is the posterior part. It is also known as dorsal part, and this is also known as ventral part. So the dorsal horn gives rise to the motor part, and the dorsal horn gives rise to the sensory part. And together these sensory part and this motor part combine to form a spinal nerve. And suppose if this is arising at the level of C5 vertebrae, so this C5 motor nerve plus this C5 sensory nerve will combine to form the C5 spinal root. So this is known as the spinal root. So similarly, the spinal roots are coming out from C5, C6, C7, C8 and T1. Now the C5 and C6 will combine to form this one trunk. The C7 will form one trunk, and the C8 and T1 will combine to form one trunk. So this is root C5 root, C6 root, C7 root, C8 root and T1 root. Now these C5 and C6 root combine to form the upper trunk. The C7 alone forms the middle trunk, and the C8 and T1 combine to form the lower trunk. Now these trunks give off divisions. So these are the divisions. So these are the divisions. Then these divisions give off chords. So actually there are three chords: the lateral chord, the posterior chord and the medial chord. And these are named so in relation with axillary artery. So assume this is the axillary artery. So this here is the axillary artery, and the cord which lies posterior to the axillary artery is known as the posterior cord. So this here is the posterior cord. uh, this will be a lateral cord and one will be the medial cord. The one which will be lying laterally will be the lateral cord, and one will be the medial cord. And a very famous mnemonic to remember these are: Ramu Taylor drinks cold beer. So for from R there are roots, then there is formation of trunk, then there is formation of division, then there is formation of chords, and finally branches come out from these chords. Now we will see this in more detail. So there was C5, C6, C7, C8 and T1. So these two formed one trunk, this formed the other trunk, and these two formed the other trunk. Now the C8 receives contribution from this as well as from this, but the C8 is kind of selfish, and it gives contribution to the one only which is present above it. So it gives contribution like this. And then there will be, so these are uh, divisions. Then there will be chords: lateral chord, posterior chord, medial chord, and there will be branches. So actually nerves can come out from these trunk as well, and from the roots as well. So from the C5 root arises one nerve which is known as the dorsal scapular nerve. So this is dorsal scapular nerve. And there is one long thoracic nerve. So this is the long thoracic nerve. So it takes contribution from all the roots, that is C5, C6, C7 and C8. So this is the long thoracic nerve. Then there is this upper trunk. So the upper trunk gives two nerves. One is the dorsal scapular nerve, and the other one is suprascapular nerve. The middle trunk and the lower trunk don't give any nerves branches. Division doesn't give any branches. Then there is chord, and the chord will give branches, which we will discuss further. So we have superficially discussed the explanation behind the brachial plexus, and now we will see this in 3D model. So this here is our C5, this is C6, this is C7, this is C8, and this small branch joining to C8 is the T1 branch. So we can see one nerve coming out from C5, and we discussed that the nerve which comes out from C5 is the dorsal scapular nerve. So this nerve over here should be the dorsal scapular nerve. Now we will see this nerve. So this nerve, as we can see, is the dorsal scapular nerve, and it is traveling, that is the dorsal scapular nerve is traveling dorsally over the scapula, and hence its name is justified, and it supplies the muscles which are present over the dorsal and medial aspect of the scapula. So we can see that three muscles are present over the dorsal and medial aspect of the scapula. First is this muscle. So this muscle will obviously elevate the scapula. So this is the levator scapulae muscle, and then there are these two muscles. So this is the rhomboid minor muscle, and this is the rhomboid major muscle. So the dorsal scapular nerve will give off a branch to levator scapulae muscle, the rhomboid minor muscle, and rhomboid major muscle. And we know that if a nerve travels close by to a muscle, then it gives off motor branches or proprioceptive branches to that muscle. So it also makes sense that since this nerve is traveling close to the levator scapulae and the rhomboid, so it must be giving a branch. Now we will see the other branches of the brachial plexus. So we have seen the dorsal scapular nerve. Now we can see one nerve which is arising from C5, taking root from C6, from C7, as well as from C8, and we will see the further course of this nerve. So this nerve over here we can see uh, is descending over the thoracic cavity and is closely opposed to the lateral wall of the thoracic cavity. So this nerve is known as the long thoracic nerve, and this long thoracic nerve we can see is traveling over the serratus anterior muscle. So these over like these like finger like muscles are the serratus anterior muscle, and long thoracic nerve is traveling over this serratus anterior. So any damage to the long thoracic nerve can lead to loss of motor supply to the serratus anterior muscle, and this is commonly seen during modified radical mastectomy. So mastectomy is removal of the breast tissue, and this is mostly done for breast cancers. So while removing breast, we it's possible that we might injure the long thoracic nerve, and in that case there will be damage to serratus anterior, and serratus anterior damage will lead to winging of scapula. So we saw the two nerves arising from the root, the dorsal scapular nerve and the long thoracic nerve. Now we will come to trunk. So we discussed earlier that that there are three trunks: the upper trunk, the middle trunk, and the lower trunk, and only the upper trunk gives off branches. So the upper trunk gives off two branches. One is the dorsal scapular, uh, one is the suprascapular nerve, and the second is nerve to subclavius. So we will see this nerve over here. So this nerve over here we can see is traveling over the scapula, over the superior surface of the scapula. So this must be superior suprascapular nerve, and now we will fade away this muscle, and we will again choose this nerve. So we can see this nerve is traveling above the scapula, superior to scapula, and giving off supply to this muscle over here and this muscle over here. So this here is the supraspinatus muscle and this here is the infraspinatus muscle. And we discussed just now that if a nerve travels very closely to a muscle, then it mostly gives either motor or proprioceptive supply to that muscle. So this is the suprascapular nerve supplying the supraspinatus and the infraspinatus muscle. Now we will see the other nerve given off by the upper trunk. So the other nerve being given off is the nerve to subclavius. I think it's not visible clearly over here, but there's this muscle known as subclavius. I have removed clavicle, but otherwise we would have seen it attached just to the inferior surface of the clavicle. So that is the nerve to subclavius, and nerve to subclavius also arises from the upper trunk. Now the middle trunk and the lower trunk don't give off any branches, and no division gives off branches. Now we will see the cords. So we discussed earlier that there are three cords: the lateral cord, the posterior cord, and the medial cord, and these have been named in relation to the axillary artery. So this is here in red is the axillary artery. So this here is the axillary artery, and we can see this cord over here, and a cord which is present beneath the axillary artery, just posterior to the axillary artery. So the one that is lateral to the axillary artery will be known as the lateral cord. So this here is the lateral cord. The one that is present posterior to it will be known as the posterior cord, and the one that is present medially to the axillary artery, like this one, will be known as the medial cord. And now we will see the branches of each of the cords. So I have removed axillary artery on this side so that we can better view of the branches. So this here is the lateral cord, and lateral cord gives off three branches. So these are remembered by a mnemonic LML, L for lateral, and the mnemonic is also LML. So first is lateral root of median nerve. So the median nerve has a lateral root and a median root. So lateral root is contributed by the lateral cord and median root is contributed by the medial cord. So this here is the lateral root and this here is the medial root, and they both combine to form the median nerve. So lateral cord will contribute to the lateral root of the median nerve. Then one of them will be the musculocutaneous nerve and one will be the lateral pectoral nerve. So as we discussed that this is the lateral root of the median nerve. This is the median root of the median nerve being given off by the medial cord, and both of them will combine to form the median nerve, which is the median nerve, which has been shown. Now we will see the other branches. So this branch over here, we can see this branch which is descending up to the to the arm. So this is the musculocutaneous nerve. So this here is the musculocutaneous nerve, and we will see the other branch. So the other branch is the lateral pectoral nerve. So we can see one branch coming superiorly and is supplying the lateral thoracic wall. So this is the lateral pectoral nerve. So we just saw the three branches of the lateral cord. One is the lateral pectoral nerve, one is the lateral root of the median nerve, this is the median root of the median nerve, and both combining to form the median nerve, and this going down is the musculocutaneous nerve. So this one over here is the musculocutaneous nerve. Now we will see the branches of the median root. So this over here is the medial cord of the brachial plexus, and the branches of the medial cord of the brachial plexus are remembered by the mnemonic M4U. So there are 4 M and 1 is U. So let's see the branches. So this over here we can see that similar to lateral pectoral nerve. This is the medial pectoral nerve, and it will be supplying over the thoracic cavity, the pectoral muscles. So this is the medial pectoral nerve. Then this is the median root of the median nerve, which was combining with the lateral root to form the median nerve. And the other two will be the medial cutaneous nerve of arm and medial cutaneous nerve of forearm. So let's see this branch over here. So we can see this branch is descending up to the level of forearm. So this must be median cutaneous nerve of forearm, and we can see it arising from the medial cord. And let's see its other branch. So this nerve over here, let's trace it downwards. So we can see that this is descending only up to the level of arm. So this must be median cutaneous nerve of arm. We just saw median cutaneous nerve of forearm, and this median cutaneous nerve of arm. So we have seen the four M's: median root of median nerve, median pectoral nerve, median cutaneous nerve of arm, median cutaneous nerve of forearm, and now we will see the last one, which will be something from you, because we discussed that the mnemonic is M4U. So this over here is the ulnar nerve. So this is the last uh, branch of the medial cord, and now we will see the divisions, the branches of the posterior cord. So this over here is the posterior cord, and also because it lies posterior to the axillary artery, so I have removed axillary artery now, but if it were present, it would be present just anteriorly to this. And the divisions of posterior cord are remembered by a mnemonic lunar, Lunar. So from L we have lower subscapular nerve, from U we have upper subscapular nerve, from N we have nerve to latissimus dorsi, from A we have the axillary nerve, and from R we have the radial nerve. So now let's trace the branches of the posterior cord. So when we rotate inferiorly, we can see two branches coming out. So first is this. So this is the upper subscapular nerve. So let's rotate this model posteriorly. We are not able to see through this, but it is supplying the uh, subscapularis muscle. It is lying near the subscapularis muscle. So this is the upper subscapular nerve being given off by the posterior cord. Then this is the lower subscapular nerve, and this over here is the thoracodorsal nerve, or the nerve to latissimus dorsi. So we can see this muscle uh, is descending over here, and I have removed latissimus dorsi in this, but latissimus dorsi is present over here, and since it is present very close to latissimus dorsi, then it must be supplying latissimus dorsi muscle. So this is the nerve to latissimus dorsi, and finally we can see this branch over here. So this is the this is over here is the radial nerve, and we can see so this is the radial nerve, and we can see one branch going over and supplying the region near the axilla. So this must be axillary nerve. So this over here is the axillary nerve, also arising from the posterior cord. So this finishes our video on the brachial plexus.